Dear colleagues, ladies and gentlemen, hello and welcome to the CME accredited video program by Springer on how to translate lupus guidelines into practice. Why are we doing this? The aims are to integrate the current clinical recommendations into daily life clinical practice to really advance the well-being and the future of our lupus patients, to show how to use standardized disease activity tools and use them despite of all the time concerns we all face, to explore and address the challenges we face also because of regional disparities and problems, and to address and understand better the unmet patient needs and understand about the problems of our patients. My name is Martin Aringer. I'm at the University Medical Center at the TU Dresden, and I've been working with lupus patients for all my clinical life, and a lot of that has changed, and I think it has changed to the good. Now, one of the challenges one faces when dealing with lupus is this is a really complex disease at first sight with all of the organ symptoms involved. And if you just think about the lupus criteria only as a framework, there's a clear pattern behind it. So on the one hand, we have autoantibodies. That is clear with the ANA, it's clear with the anti-dsDNA antibodies, it's clear with the anti-SM antibodies. It's also clear with the antiphospholipid antibodies. But there's other organ manifestations where it's just direct antibody effects, like the hematological findings. Autoimmune hemolysis is antibody-driven, so is leukopenia, thrombocytopenia, and as we understand it, at least in part, psychosis and delirium. On the other hand, those antibodies need not necessarily come as single molecules, but they get together with the antigen in the form of immune complexes. And on the lab level, that is apparent when you see C3 and C4 go down, because immune complexes actually activate the complement system. But immune complexes are what drives lupus nephritis, mucocutaneous manifestations. It's also what drives serositis, joint involvement, and even fever, because what happens there is that monocytes, macrophages, or plasmacytoid dendritic cells take up these immune complexes, recognize them, and then make the cytokines that turn to fever. So in the end, it's pretty simple. You have multiple antibodies and immune complexes, and by controlling that, you understand how to control lupus. Now, diagnostically, there is quite some uncertainty in the beginning in many of the patients if you don't have a full-blown picture. And to just keep it in mind, when you do ANA properly today in young healthy women, up to 20%, up to 1 in 5 will have positive ANA despite being healthy. So that is not a very strong argument. But what we hunt for is classical specific organ manifestations in the skin, in the joints, wherever, certainly also in the bloods and in the kidney, and fit them together with the immunological abnormalities, specific antibodies, complement system, and if you have at least two different things, so antiphospholipid antibodies and then something that is not related to it, it's quite likely lupus if ANA are positive. And it's not that much of a challenge. If there's only the diagnosis of lupus, all that falls is hydroxychloroquine and a few of the baseline measures, it's not that important to fix on the diagnosis. This is not what drives your therapy. Therapy in the end is driven by the organ manifestations, then it's pretty obvious what to do. So one of the things we try to do here is to make it simple enough to make sure it doesn't look overly complicated, because in 95% of the situations, it simply is not, and we can change a lot by doing that. Now, the program is going to go via 4 videos. 3 will be physician side, guideline recommendations and treat to target approach, standardized disease activity management, and overcoming implementation challenges there. The 4th will be on the patient voice to give us a better handle and see how the side of the patients look like today. There will also be, in the end, an infographic that is going to help to go over the treatment goals, the implementation goals, and to make it easier to do this. We hope that this will be an interesting and helpful program, and I can only invite you to enlist now and give us the chance to get into contact with you and try to make it easier to understand what's going on in this lupus field, where we have a lot of new medications, new approaches, and we are, I think, really able to tackle the challenges better now than we have ever been. Thank you so much.